Mental health cases are causing real concerns for our court system, and the Pennsylvania Court's Office of Behavioral Health is taking some steps to try and identify ways they can better deal with defendants who have special needs. Our Olivia Bosser was at a summit today in Bedford where they talked about these new strategies. So, Olivia, what challenges do the court officials see?
The number of defendants coming into the courts with pre-existing mental health concerns continues to grow, at a time when resources available to reform and rehabilitate those offenders continues to shrink. Prosecutors and defense attorneys are working together to improve cases involving defendants with mental health concerns. It's part of the Pennsylvania Court's Behavioral Health Regional Summit in Bedford.
We get much better results when we get a chance to talk to other similarly situated counties from all of those professionals to see how they're handling the challenges that we have in the justice system.
Around 65% of defendants have mental health challenges. Blair County's Chief Public Defender, Julia Burke, says part of the problem is drug use, both as the crime and as a cause for increased mental health concerns.
A psychosis induced by methamphetamine use can look identical to paranoid schizophrenia, and especially people that have that pre-existing issue or vulnerability to mental illness can be in a state of psychosis until they receive inpatient hospitalization.
But that help is becoming harder to find, according to Bedford County Court of Common Pleas President Judge Travis Livingood.
The state mental hospitals, the institutions were shut down, and the promise or the strategy was to provide more community-based help on mental health. That has not really occurred in those intervening years.
It's not just adults whose cases are delayed while awaiting treatment. Bedford County Court of Common Pleas Judge Brandy Hershey says she's had to send kids and teens with active court cases as far as Ohio to get treatment.
It's a statewide trend. It's unfortunate. The net result of that is when we have those most serious juvenile cases that need placement. There are so many juvenile offenders that need those services and not enough places. Not enough places in the Commonwealth of Pennsylvania, so occasionally we do have to look across state lines because we must the law says we must treat these juveniles.
Counties across PA are now calling for more resources, including more training and new partnerships with police and mental health care providers.
They can better identify if that person is suffering from mental health issues to de-escalate it and not turn it into a felony aggravated assault with the police officer, because then that person gets locked into the system and locked in incarceration, and then it's very difficult to provide them the help inside the jail.
Today's panel also discussed the challenges the court faces when a defendant cannot be connected to resources while incarcerated. They say it puts a strain on the jail and can substantially delay a case, especially when it can take nearly half a year to connect that defendant to help they need. Reporting live, Olivia Bosser, WTAJ News.
Olivia, thanks. This story is part of our Project Uplift initiative. That's our mission, to share meaningful stories while raising mental health awareness and connecting you with local resources. We've posted a list of those resources at WTAJ.com.